Clinicians always talk about accidental dislodgement, and we understand that it occurs all the time, but I wanted to find a way to actually measure what clinicians thought on a larger scale. And so we put together a survey and a research method in order to collect responses by clinicians working at the bedside, the actual concept of what they felt the prevalence was with their patients in different types of intravenous devices. So intravenous dislodgements are a problem for both clinicians and for patients. Basically, what we discovered was that accidental dislodgement occurred with all types of both peripheral and central venous catheters. The most common, most prevalent type of device was accidental dislodgement with short peripheral catheters. They pull out easier. That more than 58% of those respondents said that accidental dislodgement occurred daily or often with these types of devices. Approximately 96% of those who responded felt that accidental dislodgement was a safety concern, one that created a concern for both patients and for clinicians. It simply opens the patient up to greater risk of complications like infection, vein damage, thrombosis, phlebitis. And especially for some of the central venous devices that are larger, our greater safety concern is bleeding or exsanguination, where the patient may literally die from the device being pulled out. Accidental dislodgement puts them at risk for air emboli. In terms of the clinician, who's already very busy administering medications and looking after multiple patients, it requires much more time to go back and to reinsert an intravenous device. We currently use stabilization devices on almost all of our catheters in some shape or form, whether it's simple tape, a transparent dressing, or some form of manufactured securement. But as we could see from the respondents in our survey, this isn't enough because accidental dislodgement is still occurring. If a securement device isn't enough, then we need to take other measures in order to try and protect the patient from bleeding, air emboli, and some of the more serious problems or complications that can occur with accidental dislodgement.